Hi, I'm Dr. Brad Shook. I am a board-certified chiropractic physician in Hickory, North Carolina at Hickory Spine. And today I want to talk to you about epidural injections and whether or not they can cause back pain. So epidurals are commonly used injections to try and help decrease inflammation throughout the spine. What's typically done, the epidurals are referred to three different ways. Primarily, they'll refer to an epidural as a cervical epidural when it's used in the cervical spine, which is the neck, a thoracic epidural when it's used in the region of the spine where the ribs attach, or a lumbar epidural when it's used in the portion of the spine that is commonly people refer to as the low back. Okay, so depending on where it is administered, it will be described differently. So cervical epidural, thoracic epidural, and lumbar epidural. Now epidurals, what they do is they place typically a steroid medication near an area of the spine where your doctor thinks that there is inflammation, okay, that may be causing you pain. So this is very commonly used around the part of the spine where the nerve root exits. And so let me show you. Let's talk about the lower back. It's probably the most common epidural is a lumbar. So this is a model of the spine. If I turn it from the side, this is the front of the spine. These are the bones that stick out the back. If you see someone take their shirt off, you'll see the little bumps from these spines. And then between the bones, there's a disc that spaces it. And if we look closely, you'll see there's a hole right here where the nerve comes out. So this hole, very commonly what will happen is arthritis or disc material. So this disc that's spacing the bones has a jelly-like center. See it there? That jelly-like center can actually rupture. It can split through this tough outer wall and it can put pressure on the nerve. That's called a disc herniation. Now, if that occurs, the nerve gets compressed and there can be a lot of back pain. There can be pain down the leg, numbness, tingling, sciatica. And so if you've exhausted your non-surgical options, if you've tried the right types of therapeutic approaches and all of that has failed, then it may be appropriate for you to have an epidural, and your doctor can talk to you a little bit more about it. But the thing is, it's usually a needle. What they'll do, so let's say it's lumbar, they'll typically lay you down on a table, so you'd be face down. Okay, so this is facing down. This is the front. This would be your back facing up. They'll expose it. They will use X-ray, motion X-ray. So they have kind of like an X-ray camera, and it takes a lot of X-rays really quickly and lets the doctor on a screen visualize a needle going through your tissues into and getting closer to the nerve root. And they'll come in and they get it really close to the nerve, as close as they can, and they try to even come in at an angle so they can get in that hole where the nerve comes out, and they will inject the medication with the goal of trying to decrease local inflammation to the nerve and hopefully decrease your pain and symptoms and the pain down the leg. Now, it's a commonly used procedure. It's done under fluoroscopy, which I just mentioned. That's the camera X-ray. It's done under fluoroscopy. They use a needle to kind of they can see the needle on the screen and it guides them in to the correct area. Now, the issue is, can it cause back pain? Yeah, we've seen it. We've seen it cause back pain before with people. It can also create an issue where so all these nerves, let's say all the nerves, the spinal cord that runs through the center of the spine and the nerves that come out, they're wrapped in a covering called the dura. Okay, the dura is this tough coating over the nerve. If the needle that the doctor's inserting, if it hits and punctures the dura, then you can leak your spinal fluid out of a hole in the dura, because the spinal fluid circulates through the dura is like a bag that keeps it inside and around the spinal cord and the nerves, and prevents it from getting out. If the needle punctures and puts a hole in the dura, which is this bag that covers the brain, the spinal cord itself, and the nerve roots, then you can actually have leaking of cerebral spinal fluid, and that can cause major headaches. That's probably the most common problem if the dura is punctured. But yeah, we've seen people that do have persistent back pain, and it's not really well understood why they might have back pain after the epidural, except that the needle maybe irritated some of the tissues that were there. And sometimes that happens. You know, it's something that, listen, it's an important tool in the tool bag of your doctor should you need it, right? You know, what we try to do in our office is work with people non-surgically, try to work with their body as naturally as possible to help them avoid having to use powerful medications, invasive procedures like these injections, and then also, surgeries, and avoid that. And we use a lot of very innovative therapies. We use things like non-surgical spinal decompression therapy, which is very helpful for disc issues. We use things like the active therapeutic movements too. It's a piece of equipment that really helps to improve muscle coordination, and it decreases pain with movement and bending. And then we use cold laser therapy and a lot of other therapeutics that are beneficial. So I just want to share this with you guys because this is a question that comes up. It's a problem, and it's something you need to be aware of. You need to be a little bit more familiar with some of the how it's done and some of the potential risks that you have with epidurals and some of the other options that you might want to consider if you have not already tried them. But if you have any questions, or if you'd like my opinion on your case, I'd be happy to take a look at you. You can just give us a call at 828-324-0800 to see if we have an appointment time available for you so that I can take a look and see if I might be able to help your case. But if you'd like to learn more about me or our clinic, you can just go to hickoryspine.com and learn more. But I appreciate you. I hope this has helped you better understand epidurals. And if you need anything, don't hesitate to reach out. Thank you.